Hello, dear friends. I'm glad to welcome you on this repeating webinar, part of our Swiss Medica webinar series. And today we're going to talk about most frequently asked questions about stem cell therapies. Our chat is active. Please report if you cannot hear or cannot see me well, and we'll try to solve these technical issues. Meanwhile, I'm gonna continue our webinar and few words about our topic. Actually, we are talking about the most frequently asked questions about stem cell therapies. Why did we select this topic for our webinar? That's because every day Swiss Medica gets multiple questions regarding the effectiveness, the mechanisms of action, and safety of the treatments with stem cells that we provide in our clinics network. And we answer all of those. So what we decided to do, we decided to select the most common, the most hot questions about stem cell therapies and make short and comprehensive answers in this limited time, making a webinar with you. So let me open my slides. Okay. First of all, a few words about myself. My name is Dr. Sergey Mikheyev, and I am head of Moscow Swiss Medica Clinic. I am a professional physician and cardiologist, and also a specialist in regenerative medicine. Today, I will be with you, and our medical advisor, Dr. Alexandra, is also with us, and she will be responsible for our chat, and she will answer all your questions in the chat. So let's go on. A short list of questions. There are about 20 of them regarding the most important issues about stem cell therapies, its effectiveness, the list of diseases, the list of contraindications, safety concerns, types, and ways of administration of stem cells. So we are going to discuss all of those today. First of all, what kind of diseases do we treat? In fact, there is a big number of different conditions that can be treated with stem cells. And it's all evidence-based because stem cells are widely investigated in multiple clinical trials since they were discovered. So this slide demonstrates only part of the conditions that can be treated in Swiss Medica. It's actually a screenshot from our website. And I would say that we can treat neurodegenerative, musculoskeletal, cardiovascular, autoimmune, respiratory diseases, digestive system disorders, endocrine problems, and many others. So there is a multiple range, and I will talk about this later on. First of all, let's begin with the most important questions. What type of cells do you use and how do they work? And first of all, let me tell you about the type of the cells we use. In about 90% of cases, we use stem cells which are called adult multipotent mesenchymal stem cells, or briefly MMSCs. This type of cells is very widely used in clinical trials and in stem cell treatments, and we are using these cells to improve our patients' conditions. What is the function of these stem cells in our organism? So this is a pool which is kept to restore and regenerate your own tissues. These cells demonstrate ability to differentiate or transform into different cell types, into muscle cells, into nerve cells, cells of bones and cartilage, sense of tendons and fat. So these cells demonstrate multipotent differentiating capacity, so they can transform in different cell forms, but that's important, not to all cell forms. So we use adult cells. Why are these multipotent? It means multi means many, they have many potentials. And in fact, we use these stem cells because they demonstrate many important therapeutic functions. And first of all, the function to increase regeneration and tissue repair, to decrease the local inflammation. These cells can restore damaged tissue, can form new vessels, can form new tissues. So they are really multipotent, and they are at the same time quite safe. So we use this type of cells predominantly because of the good combination of efficacy and safety. What is the main mechanism of action of mesenchymal stromal stem cells? In fact, you can imagine MSC to be a factory full of beneficial factors that can be released after the administration of these stem cells into the patient's organism. These factors demonstrate anti-scarring, anti-apoptotic, angiogenic, and mitogenic activities. So all those four activities lead to increased tissue repair and regeneration. So this is called paracrine effect. So these factors are being released in the sites of inflammation or tissue damage, and they activate your local cells repair and regeneration processes. This mechanism is responsible for the most, like 80% of mesenchymal stromal stem cell action. Another thing that I have to mention is the decrease of autoimmune processes. Cultured MSC produce several factors that regulate T cell activities and lead to decrease of inflammation and autoimmune response. So in combination with tissue repair, this makes MSC quite a useful mechanism, quite a useful instrument to treat autoimmune disorders like Crohn's disease, lupus, rheumatoid arthritis, and many others. So we regulate the autoimmune aggression and we increase tissue repair using the stem cells mechanisms of action. And one more mechanism is the angiogenesis, or formation of new blood vessels. This mechanism is very useful for conditions which are accompanied by vessel damage. For example, atherosclerosis and peripheral artery disease, coronary artery disease and heart failure, diabetes, erectile dysfunction. In all those diseases, vessels are damaged, big or small vessels, they all suffer from the pathological process. And MSC demonstrate a paracrine effect. They activate endogenous endothelial cells and pericytes to form new blood vessels. And in case if we use autologous or your own MSCs, they can transform to blood vessel cells themselves. So they activate circulation, they activate the growth of new arterioles and capillaries in the sites of damage and increase reparation. For example, imagine a patient with diabetic ulcer. They suffer from depleted microcirculation, so they have a diabetic foot. And if we administer locally the mesenchymal stromal stem cells, they activate vessel growth, and this increases multiple times the rate of healing of these ulcers and recovery from diabetic foot. So this is quite a useful mechanism that may be widely used to help our patients. And again, here in this table, I try to summarize the most important factors that are affecting stem cell treatments. Regulation of axon growth, and this is quite useful for neurodegenerative diseases, demyelinating processes, remodeling of scar tissue, including glial scars, regulation of immune cell activities, stimulation of vascular growth through the secretion of vessel growth factors, reduction of inflammatory processes, and improved trophism, nourishment of nerve cells, and many other cell groups. Okay, another question that we're being asked, why do we call those cells adult stem cells? To answer this question, I have to go deeply into the classification of stem cells, and it's presented over here on this slide. And take a look. We never use embryonic stem cells, or which are derived from early days embryos, and we do not use fetal stem cells. Why? These two groups demonstrate really high replication potential, really high speed of cell growth and differentiation, but they are pluripotent, and they are not used in clinical practice because of safety concerns. Most safety trials and results are confirming the adult stem cells safety and efficacy. And so the adult stem cells are stem cells from an already formed organism where there is no need to grow a new organ. So the adult stem cells, be it cells of a newborn or an adult person, are already formed. They have only limited potential to differentiate, but they are very safe in use. So we use these cells to treat our patients, only adult stem cells. What's the source for mesenchymal stromal stem cells? Actually, in clinical practice, there are multiple sources to obtain these type of cells. As I told you, they are present in almost all organs and tissues, but only in limited numbers. But we select organs and tissues that have many MSCs in their stromal tissue. And we use bone marrow-derived stem cells, adipose tissue-derived stem cells, umbilical cord, and placenta-derived stem cells. There are some other sources of stem cells, and I would say that in our clinic in Swiss Medica, we can provide you with gingiva or gum-derived stem cells, which demonstrate a specifically high potential to regenerate muscle and bone tissue. This is quite important for musculoskeletal diseases and neurodegenerative conditions with muscle atrophy. For example, Duchenne's myodystrophy, multiple myoatrophy, and stroke regeneration, and for example, multiple sclerosis. So this is very specific type of stem cells from a specific origin. And if we take a look at the clinical trials, here you can see a classification, what types of cells were investigated in clinical trials. And bone marrow is an obvious leader, since stem cells were primarily initially described from bone marrow aspirate. And in most trials, you can see the bone marrow was the leader, but currently we observe multiple trials that describe adipose tissue-derived, umbilical cord-derived stem cells, placenta-derived stem cells, and many others. So there are multiple sources of stem cells, and in our clinics we use all of them. What's the way for administration of stem cells? Is it painful? Okay, I would tell you about many ways that stem cells can be used, and in approximately 75% of cases, we use intravenous way to administer stem cells. Why is it so useful? First of all, as you know, blood vessels are present almost in all tissues of our body, except for cornea maybe. So it's a good way to administer stem cells to all particular organs and tissues. Moreover, the stem cells demonstrate the mechanism which scientists call homing. It means that they feel the signals, the chemokines and cytokines signals from damaged tissues and organs, and they selectively migrate to those damaged areas and collect there in big numbers and try to realize their regenerative effects. So when there is a particular inflammation, for example, somewhere in the body, in the liver or in the joint, we can administer stem cells intravenously and achieve the high concentration of the injected cells in this particular damaged or inflamed tissue. It's a very important way to use stem cells, but not the only one. For example, if we try to treat ophthalmologic conditions such as ophthalmic neuritis or retinitis or glaucoma, we can use retrobulbar way of stem cell administration with a thin needle. There are other local ways to administer stem cells. For example, for arthritis and osteoarthrosis, we use intra-articular injections and para-articular injections of stem cells. To treat erectile dysfunction, we use a local intracavernous injections of mesenchymal stromal stem cells. There is one more way to administer stem cells, and it's widely used for neurodegenerative conditions. It's called intrathecal or subarachnoid way of administration. We inject stem cells directly into the liquor space of the spinal cord. Why do we do that? We do that to avoid the transport through blood-brain barrier, because the blood-brain barrier often stops paracrine factors from transmitting from blood into the brain tissue. So to go behind the blood-brain barrier, we do intrathecal injections of mesenchymal stromal stem cells. This method is widely used in neurodegenerative conditions such as multiple sclerosis and stroke rehabilitation, and we can use this in our inpatient clinics of Swissmedic. So there is one more way which is used in anti-aging programs, the local way, subcutaneous injections of stem cells into the face and neck area make you look younger and pretty, and your skin becomes shiny and bright. We often use that for anti-aging and cosmetology purposes when our patients have particular demands. So stem cells present a variety of administrations. Is it painful? Generally, it's not. If there is some procedure that requires local or general anesthesia, we provide this for our patients, so they do not really suffer from pain during the stem cell injections. What about safety? Actually, this is a very important question, a cornerstone of the stem cell treatment. And over here, I collected several reports and meta-analyses to answer this question. And to tell you briefly, is the treatment with mesenchymal stromal stem cells safe? The answer is only one, and it's yes. It is a safe treatment. And all those reports on thousands of patients demonstrate to you that the treatment with this particular type of stem cells is not only effective, but it's, first of all, it's safe for our patients. So if you want, you may send a request to our medical advisor, Dr. Alexandra, and she will share with you with those reports, and so you can read them yourself. Feel free to do that, and we encourage you to be sure in the safety of the methods that we suggest for your programs. Okay. Can these transplanted mesenchymal stromal stem cells be rejected? In fact, I would divide this question into two different questions. For autologous or your own stem cells, of course not, because the cells of your own organism are never being rejected. So if we use your own cultivated stem cells, adipose-derived, bone marrow-derived, or gingiva-derived stem cells, they cannot be rejected. The question arises if we are talking about donors' stem cells or allogenic stem cells. And the answer to this question is also no, they cannot be rejected, because MSCs are immunoprivileged type of stem cells. They do not carry specific receptors that can help immune system to recognize them and to interact with them. So the immune system is blind, it cannot see mesenchymal stromal stem cells. So they cannot be rejected. They cannot be rejected by your immune system. So there is no host and donor conflict after the stem cell injection. And it's very useful for clinical practice. This fact allows us to administer allogenic or donor stem cells intravenously and into other locations without being afraid of the rejection process. Several safety points again. Let's go briefly through the most important safety concerns. Transplant rejection. I've already told you that there is no transplant rejection of the stem cells since they are immunoprivileged. Oncology. This concern may be true for embryonic stem cells, but there are multiple reports and meta-analyses about the safety of mesenchymal stromal stem cells. They do not cause any oncologic processes. Donors' biomaterials. Very important issue, and I should say that in Swissmedica, we form passport for every particular stem cell type. So this passport includes the quality of the stem cells, the information about donors. So all the stem cells, all the donor stem cells are checked precisely for infections and any different stem cell types, and they are safe. So we have passports for all our procedures. Trials. You already know that there are multiple trials on clinicaltrials.gov, and you can go through and see that many trials are already on phase 3 and 4. So this treatment is completely evidence-based, and we are trying to help you with the newest types to increase your health and to stop your disease. Few words about complications and adverse events. Actually, for the 8 years of treatment, we observed some complications, but they're really rare, no more than 1 to 2%, and really mild. The most frequent of them is a fever that is usually well tolerated and well treated for the first 8 to 6 hours. We mention this complication in about 2% of cases. No serious adverse events since we work with the stem cell treatments. How long do the stem cells live after transplantation? Actually, as all mesenchymal stromal stem cells, most of them die for the first 2 to 3 months. Some of them may survive as long as 6 months, but after that, they all undergo apoptosis and are being removed by the immune cleavage systems and macrophages. So they do not reside for the whole life, and they share the same cellular fate as other cells that are located in our bodies. So average is 2 to 3 months. Contraindications. Of course, as all methods, there are contraindications for stem cell treatments, and one of the most important contraindications is a presence of tumors, malignant tumors. So we do not treat these conditions with the stem cells, and the presence of some malignant tumor is a contraindication for stem cell treatment. You should know about that. Okay, another types of stem cells. I told you that in 90% of cases we use MSCs, but what about the rest 10%? Actually, for very specific indications, we use hematopoietic stem cells, dendritic vaccines, and T cells to treat specific conditions, but that's very individual, and we have to discuss it with our patients when we form an individual program for Swiss medical treatment. What is the role of MSCs in anti-aging programs? Why do we use mesenchymal stromal stem cells in anti-aging? First of all, you should know that with aging, the number of stem cells in our organism is severely decreased. So at the age of 80, you have few stem cells per tissue, and their reparation ability, the ability to restore and recover from severe trauma or severe disease, is really, really low. If you're a teenager, you have a better situation with the stem cells, so the skin is more useful, the healing is faster, and there are multiple cytokines. But age is only one of the processes that can affect the number of stem cells, because, for example, severe trauma or repeated small traumas, like in sportsmen, or severe disease may lead to exhaustion of stem cell pool. So their number is being severely decreased by the age of 30, for example. And what you have to do, you have to restore your own pool of stem cells. To do that, we use anti-aging programs of stem cell treatment, and we use it quite effectively. There are multiple ways to administer stem cells, but for systemic effects, we use intravenous injections, but there are also local injections into the joints and skin, for example, for external anti-aging. So people leave our clinics being renewed from inside and outside, and they look 10, 15 years younger than they actually are. That's a quite useful method to decrease your biological age. So I've already told that we inject stem cells for anti-aging purposes into different ways, systemic administration and local administration as well. Do you use only stem cells, only stem cell therapies in your clinic? No, because we use only multiple approach to treat our patients. Conservative medicine, we treat accompanying conditions. We use IMR therapy, which is a quite specific type of therapy, internal metabolism recovery, and we'll probably have a webinar on that. Physiotherapy, psychotherapy, botulinum injections, and many others. So we try to treat our patient as an individual and try to use all possibilities, all mechanisms to improve his condition. So the stem cell treatment is very effective, but not the only one way to treat patients in Swissmedica. And a brief summary, few words about stem cells. What I want to say, it's an effective and safe way to treat many pathological conditions. Few words about Swissmedica network, and our headquarters is located in Goldach, Switzerland. There is also a research center and central laboratory. In Austria, we have a small outpatient clinic which is specialized for short programs, for example, anti-aging programs, joint problems, arthritis or osteoarthrosis, alopecia, and some other programs that can be given in outpatient way. The biggest inpatient clinics are located in Eastern Europe. For example, there is a big clinic in Belgrade that treat patients all over the world, and it's an inpatient clinics for disabled patients. For example, they treat patients with multiple sclerosis, stroke rehabilitation, and many other ways. And my clinic that I'm working in is located in Moscow, Russia, and it's also a big inpatient clinic. We treat patients with many different conditions. We have a good team of specialists from different fields of medicine, and we use multiple approach to improve your quality of life. I would be glad to welcome you to Moscow, to Swissmedica. There is also a boutique hotel in Slovenia, in Rogaška, and we use this hotel for rehabilitation purposes, for spa procedures and anti-aging programs. So Swissmedica welcomes you in our clinics and spa hotels, and we would be glad to help you with your conditions. I hoped the webinar was quite useful for you. If you have any questions, feel free to contact our medical advisor, Dr. Alexandra. She will help you to check your current condition and medical history and to understand what improvements you may expect from stem cell therapies. After that, we could form an individual program which is suitable for your particular case. Okay, it was a pleasure for me to answer all your questions and to share my knowledge about stem cell treatments. Thank you and goodbye.